I want to talk to you about something I've seen too many times in my career. A patient describing symptoms in hindsight after a heart attack that they'd actually noticed weeks or even months before the event itself, but never connected to their heart because it didn't match what they expected a warning sign to feel like. Most people picture a heart attack as sudden, dramatic chest pain, clutching your chest, collapsing. That does happen, and it's a genuine medical emergency requiring immediate care. But I want to talk to you today about a different, quieter warning sign, one that's easy to dismiss, easy to attribute to something else entirely, and one that shows up in a substantial number of patients, sometimes weeks before a cardiac event, particularly in women, though it occurs in men as well. That sign is unusual, unexplained fatigue, specifically a new, persistent exhaustion that doesn't match your activity level or sleep, and often comes with a subtle sense that even routine tasks feel more physically demanding than they used to. Let me explain the mechanism, because understanding why this happens helps explain why it's such a meaningful, if underappreciated, warning sign. Coronary artery disease, the underlying condition behind most heart attacks, develops gradually as plaque builds up inside the arteries supplying blood to your heart muscle itself. As this narrowing progresses, even before it becomes severe enough to cause the more classic, recognizable chest pain called angina, your heart may already be receiving somewhat less blood flow than it needs during periods of increased demand, like light physical activity, climbing stairs, or even just the ordinary demands of your day. Here's what this can feel like, and this is where it gets confusing for patients. Rather than pain, some people experience this reduced blood flow as a kind of generalized fatigue, a sense that their body is working harder than it should for a given task, without the classic chest discomfort most people associate with heart trouble. This pattern appears to be more common in women and in patients with diabetes, potentially related to differences in how cardiac pain signals are processed and perceived, though it certainly occurs in other patients as well. I want to walk through what distinguishes this kind of concerning fatigue from the ordinary tiredness everyone experiences occasionally, because that distinction matters clinically. The fatigue I'm describing tends to be new, meaning it represents a genuine change from your normal baseline, not something you've experienced consistently for years. It tends to be disproportionate to your activity level, meaning tasks that previously felt manageable now feel unusually demanding. It often doesn't improve significantly with rest or sleep, unlike ordinary tiredness, which typically responds to adequate rest. And it's frequently accompanied by other subtle signs: mild shortness of breath with exertion that's new for you, a vague sense of pressure or discomfort in your chest, upper back, jaw, or arms that you might not even initially recognize as related, or unusual sweating with minimal exertion. I want to be genuinely careful here because fatigue has an enormous number of possible causes, most of which have nothing to do with your heart. Poor sleep, anemia, thyroid issues, depression, and simple overwork are all far more common explanations for fatigue than cardiac disease. I'm not suggesting you should assume the worst every time you feel tired. What I am suggesting is that new, unexplained, disproportionate fatigue, particularly combined with any of those other subtle signs, or occurring in someone with known cardiovascular risk factors, deserves a conversation with your doctor specifically framed around ruling out a cardiac cause rather than being dismissed or self-attributed to stress without proper evaluation. Let's talk about who should be particularly attentive to this pattern, based on established risk factors. If you have a family history of early heart disease, diabetes, high blood pressure, high cholesterol, a history of smoking, or you're past menopause, your baseline risk is higher. And this kind of fatigue pattern deserves more prompt attention and a lower threshold for seeking evaluation than it might for someone with none of these risk factors. Here's what I'd want you to actually do if you're noticing this pattern in yourself. First, pay attention to the pattern itself, not just a single tired day. Is this new? Is it persistent, lasting more than a few days to a couple weeks? Does it occur specifically with exertion, and does it improve with rest, or does it feel unusually persistent regardless? Second, don't wait for it to become severe before mentioning it to your doctor. Describe it specifically as new, unexplained fatigue, particularly with exertion, and ask directly whether a cardiac evaluation is warranted given your specific risk factors and the pattern you're describing. This might include an EKG, blood work looking at cardiac markers, or in some cases a stress test depending on your doctor's clinical judgment. Third, and this is important, if this fatigue is accompanied by any chest pain or pressure, jaw or arm discomfort, significant shortness of breath, or a sense that something is genuinely wrong, particularly if it's acute and worsening, this warrants emergency evaluation, not a scheduled appointment. When in doubt, particularly with any combination of these symptoms occurring together, err on the side of seeking immediate care. Now, if you're finding this conversation valuable, this is exactly the kind of clinically grounded, practically useful information I like sharing on this channel, the kind of nuance that a rushed appointment sometimes doesn't have time to fully cover. If you haven't already, go ahead and subscribe because there's more content like this coming. Let's talk about why this particular symptom gets missed so often, because understanding this helps explain why I'm emphasizing it so specifically. Fatigue is such a common, nonspecific complaint that it's easy for both patients and, honestly, sometimes clinicians in a rushed setting to attribute it to something more mundane without considering a cardiac cause, particularly in patients who don't fit the classic mental image of who has heart disease, younger patients, women, or people who appear to be in reasonably good general health otherwise. Let's talk about the broader picture of atypical heart attack symptoms too, since fatigue is part of a larger category worth understanding. Nausea, indigestion-like discomfort, unusual sweating without exertion, and pain specifically in the jaw, neck, or back, rather than the classic chest-centered pain, are all recognized, if less commonly discussed, presentations of cardiac events. And again, these appear to be somewhat more common in women specifically, though they occur across all patients. Let's talk about prevention and risk reduction too, since I don't want to leave you with only a list of warning signs without also discussing what you can actually do to reduce your underlying risk. Managing blood pressure and cholesterol, maintaining a healthy weight, regular physical activity, not smoking, and managing blood sugar if you have diabetes or prediabetes all directly address the underlying arterial plaque buildup that eventually produces both the classic and the atypical symptoms we've discussed today. Let's talk about screening too, since catching underlying coronary artery disease before it produces any symptoms at all, classic or atypical, is genuinely the ideal scenario. If you have significant risk factors, discuss with your doctor whether additional screening beyond a standard checkup, such as a coronary calcium score, might be appropriate for your specific situation, since this can detect early plaque buildup before any symptoms, typical or atypical, have even begun to appear. Let me answer a few questions patients frequently ask me about this topic. First, how do I know if my fatigue is heart-related or just normal tiredness from a busy period in my life? The key distinguishing features are that it's new, disproportionate to your actual activity and sleep, often doesn't improve significantly with rest, and ideally is evaluated in the context of your overall risk factors by your doctor, rather than something you're expected to definitively diagnose yourself based on symptoms alone. Second, should I go to the emergency room for fatigue alone without any other symptoms? Generally, isolated fatigue without any other concerning symptoms would typically warrant a prompt doctor's appointment rather than an emergency room visit, unless it's severe, sudden in onset, or accompanied by any chest discomfort, shortness of breath, or other acute symptoms, in which case emergency evaluation is the appropriate response. Third, can stress or anxiety cause similar fatigue, making this genuinely hard to distinguish? Yes, absolutely. Stress and anxiety are common causes of fatigue and can even produce some overlapping physical sensations, which is exactly why proper medical evaluation matters here, rather than either assuming the worst or dismissing symptoms entirely based on your own guess about the cause. So here's what I want you to take away from our conversation today. Heart attacks aren't always announced by dramatic, unmistakable chest pain. For a meaningful number of patients, particularly women and people with diabetes, unusual, persistent, unexplained fatigue can be an earlier, quieter warning sign reflecting reduced blood flow to your heart muscle before more classic symptoms develop. This doesn't mean every tired day warrants a trip to the doctor, but new, disproportionate, persistent fatigue, particularly combined with other subtle signs or occurring alongside known risk factors, deserves genuine attention and a conversation with your doctor, not dismissal. Know your own risk factors. Pay attention to genuine changes in how your body feels. And don't hesitate to advocate for yourself and ask directly about cardiac evaluation if something feels different and concerning, even if it doesn't match the dramatic picture of a heart attack you might have in your head. If you found this helpful, my next video breaks down exactly what a coronary calcium score is and why it might be one of the most underused, valuable screening tests available for catching heart disease years before any symptoms appear at all. Make sure you're subscribed so you don't miss it. Take care of yourself. I'll see you in the next one.